polycystic ovary syndrome is the commonest endocrine disorder in women of reproductive age. It is in fact heterogeneous disorder, and different women present with different dominant clinical features and hormonal abnormalities. Polycystic ovaries on ultrasound are relatively frequent finding and could be seen in 20 to 25% of women of reproductive age. Only a proportion of them have indeed polycystic ovary syndrome, and we think that the prevalence of PCOS is between 8 and 10%. In order to qualify for the diagnosis of polycystic ovary syndrome, one has to have, in addition to polycystic ovaries on ultrasound, any of the clinical features or any of the hormonal abnormalities which are characteristics of PCOS. The commonest symptoms of polycystic ovary syndrome are menstrual cycle irregularities, signs of hyperandrogenism, which are unwanted hair growth, acne and scalp hair loss, and obesity, which is present in a significant proportion of women. As for menstrual cycle irregularity, the vast proportion, about 70%, would have oligomenorrhea, which means periods at 2, 3, 4 monthly intervals. Around 20% would have complete lack of periods, which is amenorrhea, and the rest would have either regular periods or more frequent bleeding. As for hirsutism or unwanted hair growth, which could be a cause for significant problems in young women, it could be of varied degree. Fortunately, in vast majority of women it is very mild, but in a proportion of women it could be quite severe. The treatment of polycystic ovary syndrome is symptomatic. In other words, we cannot offer treatment which would cure the problem, but we can offer various treatments depending on what is the focus of that particular patient attention, whether it is irregular periods or unwanted hair growth or infertility. Therefore, if you have a young woman with irregular periods or a lack of periods, we could provide treatment with either cyclical progesterone or contraceptive pill. If the main focus of clinical attention is unwanted hair growth and hirsutism, we treat that with a combination of contraceptive pill and anti-androgens. And if fertility is the issue, then there is an array of treatments starting from tablets and then injections, and this is usually done by fertility specialists.